My name is Bernard. I'm with Insurance Advisors Direct. And as we ramp up for AEP, we have opportunities with different retail locations. And one in particular is Oak Street Health. And we have Miss Lakeisha Ross on here to present to you opportunities with Oak Street. So Lakeisha here, go ahead and take it away.
Good morning, guys. My name is Lakeisha. I am the Senior Regional Partnership Manager for Oak Street Health. I support our Michigan and Western Pennsylvania locations. I just wanted to join today to talk a little bit about Oak Street and the things that we do. I know that some of you all may have been collaborators with Oak Street in the past, either in our center or in the community. And I just wanted to take the time today to go over some of the things that we have now implemented as a way to ensure that we're supporting our agents. So the first thing that I want to touch on that has been a frequent question of ours is Oak Street and CVS. Oak Street actually was acquired this last year by CVS. We are really excited to be a part of the CVS brand. With Oak Street being a part of the CVS brand, we still operate in the ways that we have in the past. What I mean by that is while we are owned by CVS at this time, we are still operating as a primary care doctor's office for adults that are on for Medicare. With that, one of the second questions I believe that I received was, what does that mean for Oak Street and the carriers that they accept? Because many of our agents know that Oak Street and Aetna are both under the CVS umbrella. While Aetna is a great partner of ours, they were a great partner of ours before the acquisition with Oak Street and CVS. We still remain multi-payer. So what does that mean? We accept all the same plans that we did before. We do work very closely with all of our carrier partners. With Oak Street in Michigan in particular, we have tried to change the way in which we support our agents. We've had a couple of trials and tribulations. What I mean by that is we tried a few things that may have worked, you guys may have felt did not work. And based off the feedback that you guys gave, we worked to find a way that we can ensure we're supporting our agents in the way that they want. The first thing that we did last year, we actually welcomed back what we called our community relations managers. Our community relation managers are a part of our outreach sales team. And I'll actually scale back a little bit because I recognize that there may be some on the call that do not recognize what Oak Street is. Oak Street, we are a primary care doctor's office for older adults on Medicare. I typically say older adults and not seniors because we actually do see a younger population as long as they have full Medicare. But with that, what sets Oak Street apart from your typical primary care doctor's office is longer appointment times. Typically, and you guys may have heard me joke about this several times, in my PCP, I'm in and out in 10 minutes. I probably wait longer to see the doctor than I do to actually speak with my doctor. At Oak Street, our appointments on average are 20 to 40 minutes, and that is actual provider facing time. Another thing that sets us apart is during that provider facing time, we actually have what we call a scribe that comes in the room with the provider and the patient, and they take the notes for the providers. The reason why we do that is because we understand our patients want to feel heard, and allowing us to have someone in the room to take notes for the provider allows our provider to have your full undivided attention so that you can explain to them what you may be experiencing health wise, and we can create a personalized care plan and efforts to keep you happy, healthy, and out of the hospital. Along with that, at Oak Street, we do provide complimentary transportation to and from all of our appointments. We typically say complimentary, we never say free because, as you guys know, this is not a part of our patient's insurance. We typically tell them with your insurance that you have, please use those rides towards your specialist visits. Oak Street will provide complimentary transportation to and from appointments at our centers. We have a outreach sales team that can consist of 2 to 4 people. What that looks like per center is a team that is out actively in the community doing grassroots efforts. They're typically the best friends of many of our agents that we collaborate with in the community on a day-to-day basis. They go out to different community vendors or what we call field accounts, and they try and build awareness of Oak Street through engaging with different facilities. What that can look like is we go to community centers, we go to senior living facilities, we go to food pantries, we go to health expos, we just go to different places that are in the neighborhoods of our center and bring awareness to Oak Street. With that education piece, we tell our prospects or leads at that point, what we call them, we tell them a little bit about Oak Street, but we also bring the fun to them. So that can be through doing a bingo, a ice cream social, a pizza party, chair yoga. We do hustle and ballrooms, just different things to bring that engagement to our older adults that are on Medicare. With that, our outreach team is typically in the community about 80 to 90% of the time, trying to find different resources in which we can bring that Oak Street awareness while also getting those patients to come into our facilities for an appointment. Perfect opportunity to meet the provider. And that is so important because at those events, we cannot be as successful as we have been without the help of our agents. Typically, we invite agents in the community with us to partake in those events. While we may know a lot about healthcare, we know almost nothing about insurance as it relates to specific benefits that potential leads or clients, as you may call them, can qualify for. So it's a great opportunity for agents to partner with us or collaborate with us in the community in efforts for you guys to grow your books of business, and then Oak Street to, of course, bring awareness to Oak Street. At Oak Street Centers, we do allow same and next day appointments to all of our patients. And we also have what we call a patient relations manager, who is the first in center point of contact for all new and existing patients. Now, that is the two of your best friends. So, outreach and your patient relation managers are excellent partners. Patient relation managers are the ones who are, again, the first and center point of contact, ensuring that our patients are eligible to be seen. So, as you guys know, the number one reason why a lot of people may fear the providers is not only because of being sick, but also because of they don't want bills. They possibly can't afford the bills. Our patient relation managers not only confirm eligibility for all of our patients, but they also are the ones that do those warm transfers to those agents that engage with us in the community, as a way for our patients to take advantage of additional benefits they may not know they have available, but also as an opportunity for our trusted agent collaborators to be able to build their book of business. One thing that I did mention, I'm not sure if you guys noticed, but I mentioned that those that are actively engaged with us, something that we've experienced in the past is on both ends. Some of our agents have expressed that they felt Oak Street was not as engaged with them. And then some of our outreach team or even our patient relation manager team may have felt that our agents were not as engaged with them. And we are working to bridge that gap. Some of the things that we've done to help bridge the gap, we recognize that things do change quite often, whether that's with our team or even with our agents. Internally, what we're doing to improve our communication with our agents is we are huddling with our agents each morning during agent of the day shifts. We are planning more events with them in the community. We are actually asking them to help us to let them know what does a successful event look like to them. While we have our own idea, we do understand that our agents sometimes know better than us what works. So we're doing more planning with them, better communication and alignment. We are making sure we're protecting the agent of record. We're doing that several ways. I am doing audits myself to ensure that any agent that connected a patient to Oak Street is followed up with. How does that look? When a referral is sent to Oak Street, we actually have a CRM system called Salesforce that we use to log all of our agent referrals. With that, I typically audit on a monthly basis to see, have we seen those patients? Have we had a hard time contacting them? Basically, what happened throughout the process, and just give our agents a heads up. I know you guys may refer and you're like, okay, well, what happened to my patient? We are working to ensure that you guys have the appropriate messaging. You may get a email or a phone call from myself or a member of our team that says, hey, we got your patient scheduled for a visit. Hey, they needed transportation. They're going to be on transportation. Hey, your patient had a question about their benefits. We're doing all we can to ensure that that communication is there, so you're not stuck wondering what is going on with a lead that you sent to Oak Street. I always say that now, more than ever, the time for agents are needed. As you guys know, we are going into AEP, and this AEP honestly will be an AEP like no other. With that, we are ensuring that all of our patients that are on managed care plans, we are letting them know if they have any questions about their insurance, please reach out to us and we'll get them back in contact with you. What we realize is that our patients get a million phone calls per day. Our agents may have switched for some reason. Maybe they have went from captive to independent, or maybe their phone number changed, or maybe they're just so busy that they can't answer every call. We understand that our patients know that the agents we work with are trusted collaborators of Oak Street. And with them knowing that we can assist them, we get them connected right back to you so that you can maintain your book of business. With that, we also do 30, 60, and 90-day retention calls to all of our patients that are on managed care or even just have questions about managed care. And those questions that they may have, we ensure that we get them connected right back to their agent of record in efforts for them to answer or address those questions. I often say a lot of times we hear it so often in our facility that a patient will say, well, why does my neighbor have this many benefits and I only have that? And what we found is that they have those benefits. It just may not be the same benefit because at the time something else was of greater need to them, such as prescriptions or dentures or whatever the case may be. With that, again, in our centers, we're working to do all we can to ensure that as we are working with our agents, they feel supported. We're helping to grow their book of business. We are sending referrals their way. We are planning with them. We are being very vocal. And this is just me wanting to share some of the updates that we made, but this is totally based off of the feedback we've received from agents. Another feedback request that I received from an agent was, how are we going to work to ensure that they're looped in on Oak Street staff, whether that is a provider or if that is a member of outreach. I myself, especially during AEP, will be working to provide monthly updates of our providers per location. What that will look like is, as you know, sometimes as we accept new plans or as providers come or leave the facility, your provider list may change for patients' PCP. I am working with those agents that we are actively in the community with, or even those that just want to know what providers we have, to send monthly updates in regards to our provider panel, but also even our outreach team. In the past, sometimes our outreach team, as you guys know, is a sales role. Sometimes our team may have a high turnover, or some may come, some may go. We are now internally having bi-weekly meetings to discuss just that. We are discussing, have we had any new members join our team? Have we had any new members leave our team within these last 2 weeks? If anyone has left our team, who is going to be their replacement and what agents were they working with, so that we can ensure that we get that agent connected back to a new outreach executive that may be another strong partner that they can grow with. Were there any events planned with that agent that may have left the organization, and was any agent attached to that event? What is our plan for continuing that event, setting it up for success, and ensuring that that agent still gets the same support that they were going to have with the outreach executive that may have left? We are doing all that we can to ensure that our agents, again, feel supported now, during AEP, and even beyond, but we cannot do that without the feedback from our agents. So I know I said a mouthful in such a little bit of time, but I'm just very excited because I'm starting to now see all of the changes that are coming from this. And another big thing I'm excited about actually is our Burton location, which is in Genesee County. We actually, since we're now under the CVS umbrella, that location actually has a CVS pharmacy on the inside. We are hopeful that in the near future, we will see that in a lot more of our facilities, but that CVS pharmacy that sits right inside that facility does provide the means of just having a right there while you're at the facility access to your prescriptions that you may need. In addition to that, having those over-the-counter benefits available that you can easily use your flex card or whatever it is that you may have to just purchase that right there while you're in our center. And that is open to patients that, whether they are a patient of Oak Street or are not a patient of Oak Street. How does that benefit our agents? Because we may have someone that wants to take advantage of a CVS pharmacy that may not be a patient of Oak Street, and they may not have the insurance that Oak Street accepts, and that patient then will be sent to one of our trusted agent partners. And a fun fact about that is actually no CVS out in the Genesee area, so that is actually one of the first ones, and it's in our actual facility. the last thing that I wanted to address before we go into any questions is I was made aware that Aetna has sent a email out about the patients that are seen at Oak Street. While we are still working through communication to go out to all of our agents about it, we still work with our WellCare patients that are already on our patient panel the same way as we have in the past. So any patient that was already on WellCare prior to any communication that went out, we are still seeing those patients with no issues in our centers. Um, WellCare, we have a great relationship. I work really closely with Emily and Jamie and Kevin. So we're just working through communication because we were also recently made aware of that communication, and our compliance team is working for us to be able to provide the appropriate communication. So while I may not have much insight, I did want to let you guys know that any patient that you guys already may have on WellCare at Oak Street, totally fine. They're still being seen and their care is still being given at Oak Street. We are just working through a plan that we hope we will soon be able to resolve prior to AEP, but more communication is to come. As we receive communication on what next steps may look like for us, I'll be sure to send it to Bernard so that he can share it out with the team. Thank you.
Thank you, Miss Lakeisha. Folks, do you have any questions? You can type them in the chat room. I guess while folks may be typing questions in, Lakeisha, what is the next steps for, say, for folks with agents with Insurance Advisors Direct that want to partner with Oak Street? What can they do?
Two-part answer because one I actually forgot to mention. We are actually opening up a location in Saginaw and Lansing. Both are to come the second week of October, right in time for AEP. We are hopeful that many agents will show interest in that location and want to get out in the community. It is a location that is untouched by Oak Street centers or any of our competitors. So great opportunity to collaborate with us. But if you guys would like to get involved, I would love to have a one-on-one conversation with any agent that is involved. You can feel free to give any agent my phone number. And I typically like to meet with the agents first and either provide a tour and to listen and understand what does success look like for you. Because Oak Street, we are very grassroots oriented and we understand that that may not be the case for all of our agents. So I would love to know for the agents that whether you want to be grassroots or choose to not be grassroots, how can we best support you in growing your book of business where it is a collaborative relationship, where it's not just one side and it may be Oak Street inviting you or sending referrals, and it's something that you feel that you can have a hand in and we can grow together ultimately. But the first step, I guess, would be to just reach out to myself and we can talk through options, locations, and just what does success look like for you.
Okay, cool. So what I'll do, folks, I mean, I'll be reaching out to everyone. And if you are interested, I'll take your contact information. I'll also give you Lakeisha's contact information, and then I'll forward it on over to Lakeisha as well. Great opportunity for folks to partner with Oak Street. They have, like I said, a lot of opportunities as far as community. I think that is probably the biggest thing, is to go out in the community as well as agent of the day. Me personally, I'm more a fan of the community, going out, reaching out to community, and probably get more folks that way. But yeah, whatever works for you. And I know Miss Lakeisha, she'll make it work with Oak Street for us.
Definitely. I'm really excited, and I hope that many of you show interest in Oak Street. We've done a lot of events that we haven't done in the past, and I really credit most of it to CVS and us being under their umbrella. We've done events such as lead marketing events. Not sure if you guys have heard of them, but just to give you an example, it is an opportunity where it's an educational event. It is not carrier facing, it is not Oak Street facing, but of course, Oak Street sponsors it in addition to one of our carriers. And it's general Medicare education and questions, but we typically have them at places such as we've had one at a restaurant called Hopcat. Not sure if you guys are familiar with that. but we sent out mailers. We used a third-party marketing organization to send out mailers. Our teams worked internally to make those RSVP calls just to make sure that those that RSVP were going to come. And our carrier helped to co-sponsor the food standpoint. Our agent had to do nothing but show up, and we are very appreciative of our agents that showed up because they did an amazing job, and we're trying to lean more into this as AEP approaches. But with that, we actually had, for one of our events that I actually attended, we had an RSVP count of 50. We had over 75 people show up, and 80% of those people actually came to Oak Street for a what we call a welcome visit, if you guys are not familiar. And with that, our agents that we work with have reported to us that they still have patients that are, or prospects, reaching out to them from that event, or they're sending their friends, family. They're all still getting phone calls from that. And in addition to what the patients have taken the initiative to do on their own for contact, any patient that came into our center and they had attended that event, that agent that was at that educational event, we add them as what we call our agent of record for that event. So if the patients show interest while in our center of wanting to be on a managed care plan and they don't already have an agent of record, we're sending them back to that agent. So our agents yearly, well, throughout the year, I'm sorry, have been growing their books of business, and it just shows through a testament of what Oak Street is trying to do to involve our agents, make them feel more supportive, and to give back. And that is a great opportunity for you guys, especially as we open up new locations in areas that we're not in, our competitors are not in, and a great opportunity again for us to just get out into that community and grow together.
Okay. Well, actually, I'm going to ask questions for the agents then.
No problem.
What plans does Oak Street offer, and are they accepted at all locations in Michigan?
Sorry, I didn't notice I had got back on mute. So we currently accept Humana, we accept Zing, we accept Priority, we accept HAP, Molina, Aetna, and Blue Cross. And then we are tentative on WellCare. And the reason why I say that is because, again, we're working through communications for that, but we still have a large patient panel of WellCare patients that are still being seen and going to continue to be seen within our facilities. But that is something that I can share with you as well, our list of accepted plans, just in case any agent asks later on.
And they're offered at all locations throughout
Yep,
Michigan.
they're offered at all of our locations. Yes.
All right, great, great. Okay, folks. Go one more time. Any questions from the audience for Miss Lakeisha? If not, like I say, I'll contact you. You have any questions, give them to me. If I can't answer it, I'll reach out to Lakeisha to get the answer, and I think we can go from there. All right,
Definitely.
so
Thank
go
you for
ahead.
setting this up. Oh, I see we have a question.
We have
It says Frazier, I believe.
yeah. Yeah, let me see if I can unmute you, Frazier, and yep, there we go.
I just had a question. Can you give me a breakdown of what you refer to when you say being more grassroots?
So our agents that we collaborate with in the community, grassroots looks like just tabling events. We do a lot of tabling events, whether that is in one of our local community stores. Like I know we table in grocery stores, we table in CVS's. We go to senior living facilities and set up bingos. We go to health expos. We do food pantries, just different things in the community. Some of our centers go to churches, just whoever will allow Oak Street to come in and speak to the demographic in which we serve. But in grassroots, we typically just invite our agents with us because, again, sometimes our patients just don't have the education of what they may qualify for. And having those agents with us just allows them to get the education as well as potentially grow the books of business for our agents.
Okay, great. Does the agents have, if they want to do their own little seminar, will they have access to the community rooms at Oak Street to do those as long as it's
It is
in compliance?
Of course, it is encouraged. Please feel free to use our community rooms. To be quite transparent, we still use them in the same way we have in the past, but we have been more grassroots focused. But we do still host a lot of events there. I'm not sure if any of you are familiar with Rosedale Park, but Rosedale Park and Cherry Hill, they have very popular chair yoga classes. Or if you're familiar with Fast Freddy, he goes to Rosedale and does like hustle and ballroom. But in some of our other centers, since COVID, just to be transparent, while the community room is there, our attendance has not been there. So for that reason, our outreach team has been more community focused, just because some of our patients or even our leads may not have means to get to our centers. And so we are trying to work to bring that back. And that is why it's so encouraged that if our agents want to host anything in our facilities, please feel free to do so. We can help from a standpoint of helping to co-sponsor or co-market an event. Great opportunity for us all.
Okay, thanks, Lakeisha. All right, folks, are there any other questions? Nope. Well, again, Lakeisha, thank you. And I know folks will, once I get in touch with folks about Oak Street opportunities, I will forward the names and contact information on over to you. And like I say, and I agree with you, this is going to be a different and probably a more busier AEP this year than previous years. So folks, please jump on this opportunity with Oak Street. We'll definitely help you with your bottom line. So that's it.
Yeah, and
anything else?
just one more thing. Until we actually get or see interest from IAD, if you don't mind, I'll just continue to send the information to you. And maybe as you guys become interested in collaborating with us, you would at least have the most up-to-date things of what we have going on by our centers or providers or just any changes.
Perfect. Thank you. Thank you.
Thank you.
Okay. Oh, go ahead, Fraser.
Yeah, just one more thing. Just wanted to know what she was referring to when she said managed care. Are you just referring to just pretty much all the plans in general, the work that you do? Or are you referring to something different?
When we speak to managed care, typically the plans that we accept within our facility. So the managed care plans that are offered through patients that are on managed care. So that would be the Aetna, the HAT plans, the Blue Cross plans, just the different plans available for the older adults that are on Medicare that are accepted within our facilities.
Okay, perfect.
Yes,
perfect.
sir.
Thank you.
Thank you.
All right. Thanks, Fraser. All right, folks. Well, that's it. Everybody, you have a great rest of your day. Again, Lakeisha, thank you. And we look forward to many more opportunities with you and Oak Street.
Thank you. You guys have a great day. I'm always here if you need me. Bye.
All right. Take care, everybody. Bye.